Hi, I'm Dr. Wu from the California Center for Reproductive Health, and today I wanted to talk a little bit more about IVF. So the indications for IVF, who should be looking into that IVF treatment, the process for IVF, and also the success rate. So first of all, IVF stands for in vitro fertilization. And what it actually means is in vitro, so out of your body, fertilization, so combination of sperm and an egg. Okay, so it's actually a very small process. When people are actually thinking of IVF, they're thinking of the bigger picture of injections of hormones and everything. But really, in vitro fertilization is really just the fertilization of the egg and the sperm outside of the body. Okay. Who should start looking into IVF treatment? So I think most importantly, if you are trying to conceive, if it's been about 6 months, you should call and set up a consultation with an infertility specialist, especially if you're over the age of 35. Or if you have any other medical issues, so irregular periods or chronic medical health issues, it's always good to kind of reach out to your OBGYN first and see if there's any consultation, preconception consultation they can go through with you prior to meeting with us or having them refer you to one of the REI specialists. So for in vitro fertilization, again, this is a very finite part of actually egg and sperm meeting outside of the body, but there's many ways to get to that point. There are natural cycle IVF, minimal stimulation IVF, and then even with IVF, there are lots of different protocols depending on your personal ovarian reserve or your personal reproductive history. So I'm going to give a very general kind of idea of what IVF the process looks like for a standard stimulation, okay? So first of all, I'm going to start with a little bit of background biology because I think it's really important to understand what you're doing to really understand how we can successfully achieve a pregnancy, okay? So first of all, you're born with all your eggs. All your eggs are stored in your ovaries. Unlike men who make new sperm every day, women do not generate or make new eggs, okay? So everything you're born with is already stored in the ovaries. So I think of the ovaries as kind of like a deep freezer, okay? At the start of your cycle, at the start of your period, a group of eggs from this deep storage will start to grow to a point where you can actually see them on ultrasound, okay? So this is kind of your follicle count for the month. Your body will make enough hormone called follicle stimulating hormone, or FSH, to recruit and select one egg to continue to grow and ovulate. At the end of the month, if that egg is not fertilized, that egg will degenerate and will die, but so will the entire batch that it started with, okay? So you lose actually a group of eggs every month, not just one. So essentially what we're doing when we do IVF, or when we say IVF, is we actually give you injections of hormones with the start of your cycle that will recruit and rescue this group of eggs. So if you bring up a batch of 10 to 15 eggs, we're giving you injections of hormones to try to rescue and essentially support all 10 to 15 eggs to grow, okay? The process involves injections of medications, 2 to 3 injections that you do at home every day. And during this 10 days of injections, you'll be coming into the clinic for ultrasounds, blood work to make sure that all these follicles are all growing well, okay? At the end of this 10 days of injections, approximately, you'll actually do a egg retrieval, which is a small procedure. It's 30 minutes outpatient. You are asleep for it, so it's very heavy sedation, so you don't feel anything, you don't remember anything. And essentially what we're doing is we're taking a needle and we're putting it through the vagina and into each pocket of fluid that was growing in an egg. The embryologist will then look under the microscope to see if that egg is mature, so a usable egg, a healthy egg, or if it's an egg that's immature or an egg that's already falling apart, a bad quality egg, okay? All the mature eggs will then actually get combined with sperm, either for standard insemination where it's put into a petri dish with sperm, or through intracytoplasmic sperm injection where we actually take a sperm and inject it into the egg to make sure that they meet. And that is actually the process for in vitro fertilization. After the egg and the sperm meet, after fertilization happens, we do culture the embryo, okay? And at that point, depending on, again, your indication or consultation with your physician, you would either have a fresh transfer, the embryo goes back into the uterus, or the embryos can be biopsied for additional genetic testing and then frozen. and then used with the following month or at a later time. So a lot of patients also have questions about what is the success rate for IVF? And I think that it's actually a very complicated answer to that, but in general, the success rates will drop with each age category. At the California Center for Reproductive Health, we do have a much higher success rate than the national average that's published through SART. But I would advise every patient to kind of talk to their physician first to give you a very personalized, depending on what your reproductive history is, what your ovarian reserve is, a very personalized number for your chances of success. So I think that's really important to keep in mind. So thank you for watching today. If you have any questions, feel free to reach out to us. Or if you want, we have more videos you can watch on YouTube.